It was a time that there was actually a national crisis in the Department of Veteran Affairs back in 2014, what people often now call the wait time crisis. When I entered government, at that time I was the CEO of a large private hospital system in New Jersey. And it was a time that there was actually a national crisis in the Department of Veteran Affairs back in 2014, what people often now call the wait time crisis, where a lot of veterans were returning from Iraq and Afghanistan with devastating injuries. Our Vietnam veterans were turning 75 and requiring a lot of healthcare services, and the VA was overwhelmed and clearly not succeeding in its mission. And that resulted in the resignation of the secretary at the time, the undersecretary. It was a national scandal in many senses. And when President Obama asked me to come in to try to help fix this, I basically thought, look, this system may be so broken that it may not be capable of being fixed. And the very best thing that I could do is to shut the system down, do it in an orderly fashion, but get the veterans into the private sector, the area that I knew the best, that I had been doing my whole career, and make sure that they got the right help. And when I got to the VA and I got to see the type of care that was being delivered, the mission that the organization had, the passion that the employees had for caring for veterans, I came up with the assessment that it was exactly the opposite, that the VA system was essential, that it couldn't be replicated by just simply sending veterans out into the community, that veterans would suffer that way. And so I felt a very strong commitment at that point to making sure that we could fix this system and make it sustainable for not only the current group of veterans, but those in the future, so that it would be there as a national resource.